Hi, my name is Dr. Todd. I'm a licensed clinical psychologist, and I've spent my whole career working with children, teens, and young adults, although I work with a lot of adults as well. My training is in clinical psychology, which means I was trained not to just talk with people, but to deeply assess how they think, feel, learn, regulate emotions, and behave. So a large part of my work over the years has been psychological testing and diagnostic evaluation. Let me explain what that means, because testing is often misunderstood. Psychological testing is not just one single test. It's actually a process, and we use many tests, and the goal isn't just to label someone. We do come up with diagnostic labels, but the real goal is to understand them. What are their strengths? What are their weaknesses? And how do we help them move forward? Testing actually gives us a snapshot of how that person is functioning at a specific point in time across different areas like learning, attention, emotional regulation, behavior, and personality. Testing can assess all sorts of things. Very common would be questions about ADHD or learning disorders, anxiety, depression, personality disorders, trauma. I've seen it all. And a comprehensive evaluation usually includes several parts. It starts with interviews. It means I'm going to talk with a client. I'm going to talk to the parents or other caregivers. These conversations matter a lot because they give me context. They help me understand the story behind the symptoms and the person. I also use norm reference measures. These are standardized instruments, so it's not just me asking questions and getting answers, but I'm actually getting test data. And these allow me to compare someone that I'm testing to others their age. So we can tell, is this a problem typical for that age, or is this outside the range of what's normal? Is it actually a problem? And so using these tests can be critical to understanding what's normal and what's not normal. I also make a lot of behavioral observations during the testing. That will include how that person might be approaching the tasks, how they handle frustration, how quickly they get frustrated, do they give up quickly, how fast do they fatigue, how do they communicate with me, and what kind of changes I might see in their body language or their mood. These details matter a lot because now I'm seeing some of the problems in real time. I also look at records and background information. Testing can actually be very technical, but there is definitely an art to it. And that art is building trust with that person that you're evaluating, helping that person feel safe enough to open up to you. I try really hard not to over-pathologize normal struggles. I try really hard not to over-diagnose, but I also don't want to minimize real struggles. Now, I take all of this data, my observations, the background information, the actual test data, I put it all together, and I see how it all fits together. And then I try to translate that into something that's useful for you, where I can give you really clear explanations, practical recommendations, and guides that actually helps you move forward. My whole goal is to bring you clarity and help you understand it very clearly. I don't use psychobabble, and I just want to help you figure out how do we take this problem that we're struggling with and move forward in life. I also want to clarify something that I'm asked about a lot, and that's the difference between a psychologist and a psychiatrist. I work with many wonderful psychiatrists. They go to medical school, and they're medical doctors, so they're trained to prescribe medication among many other things they're trained to do. Psychologists like myself don't go to medical school. We have PhDs. We get training in clinical psychology, and so we are trained in assessments, diagnosis, and therapy. So I'm a specialist in psychological testing and interpretation so that I can help you understand how we can take all this information and translate it into something that's helpful for you to move forward. My role is to understand the person, not just the symptoms. And I want to understand how everything fits together and how we can help that person, how we can help you make informed decisions about what to do next. I've been doing this for a long time. I probably tested somewhere between 5,000 and 8,000 people in the last 30 years with all age ranges, and I love it. I'm deeply invested in helping you find the answers that you're looking for here at The Antidote.